Our first presenter is Jordan Neusch, presenting the need for mental health education in secondary schools.
As I was wonderfully introduced, my name is Jordan Neusch. I'm a clinical psychology major and a junior here at Robert Morris University. And today we're going to be talking a little bit about mental health education in secondary or high schools in Pennsylvania specifically. So some of the major topics we're going to be talking about today are the prevalence of mental disorders amongst adolescents, the current levels of mental health literacy amongst adolescents, the stigma of mental illness and how this affects help-seeking behavior, mental health education programs and their efficacy, and the current academic standards in Pennsylvania in relation to mental health education. So starting off, mental health issues in adolescence. The peak vulnerability for developing some sort of mental health issue, be it major or minor, falls between the ages of 16 and 24. And this mainly falls from the increased stress and the consequences of that stress. Stress levels are highly correlated with increased levels of anxiety and depression, and this is especially so for adolescents who are in a period of development that involves physical development, changes in the body going through puberty and maturation, cognitive development, an immense amount of learning, not only about the outside world but about themselves, and emotional learning, going through things with relationships, changing relationships with their parents and family dynamics, and all this puts a large amount of stress on them. And there's also, in addition to these internal stressors, there's many external stressors that these adolescents have to deal with. Most high school students have to go through 8 hours of class 5 days a week. They're expected to do extracurricular activities. Some hold jobs. They're expected to do homework and study for tests. And all this work and effort they put in, it's really good for their academic success, but the decreased amount of leisure and relaxation time can have very bad consequences for their mental health. As I said, stress is highly correlated with developing mood and anxiety disorders, both of which can have a large effect on a person's quality of life. And with previous mental disorders, not all students just develop mental disorders as they are going through high school. Many students come into high school with previous disorders they developed in childhood, such as attention deficit hyperactive disorder or other mood or behavior disorders. And these can be exaggerated by the growth I mentioned earlier. Someone who already has behavioral issues and starts going through puberty may be able to less likely regulate their emotions and behavior than they would have even in childhood. And these disorders have a very cyclical nature. Stress leads to the disorder, and the disorder leads to more stress. And without the proper medical or professional intervention, it can spiral out of control from just being a little depressed and down in the mornings to not being able to get out of bed completely. And to put a number on it, 1 in 5 students, or 20% of all high school students, are presumed to have some sort of mental disorder, be it a major disorder, which is DSM diagnosable, or just a minor disorder that's sort of interfering in their life, but they're able to get through their life all right, get through the day, get through school, things like that, but they don't feel great. So talking about mental health literacy. Mental health literacy is defined as the ability to recognize symptoms and conditions of mental disorders, knowledge of risk factors, beliefs about causes, interventions, and how to seek information and help. So how much do students know about mental health, their mental health personally, mental health at large, and how to seek help for issues? A 2010 study done by Olson and Kennedy measured mental health literacy in small schools in Virginia. They found that most students have an inability to recognize very basic and common mental disorders. In fact, only 27% of the students could recognize anxiety from a small vignette describing the disorder. Slightly better than that, 42% of students could recognize depression from a similar vignette. But it just shows that students don't understand and they can't recognize the formal aspects of these disorders. So if they're suffering from a problem, they're not going to be able to identify that, 1, they have a problem, and 2, how to seek help. And a big problem with this is a lack of formal research. It took me a long time just to find the one study done in the United States about mental health literacy, and they're few and far between the ones that are out there. But fortunately, they all do correlate to the fact that we aren't teaching our students enough about mental health education. So speaking of stigma of mental illness, as I mentioned before, 20% of students are presumed to be suffering from some sort of mental illness or disorder, yet only 6% of students ever seek help. A 2010 study by Gulliver with the aim to see why students don't seek mental help when they need it. And it turns out the main reason is many students have negative attitudes about mental illness. They don't want to have to come out and tell people that they're suffering from them for fear of the negative stigma towards them. They don't want to feel different from their peers. They don't want to feel separated from their peers. They don't want to feel like an outcast. And this is very different in contrast to how our culture treats other illnesses. There's organizations nationwide to rally behind cancer patients, people with ALS, but for mental illness, there's sort of a hush-hush about it. You're not supposed to let people know about it. We don't celebrate these diseases as we do others. A 2007 study looked for how do adolescents describe what they think mental illness is, and the results are pretty shocking. Some of the most common terms that students gave for people suffering from mental illness were nuts, psycho, and freak, obviously very derogatory and negative in nature. And a 2012 study found that these issues stem from just a basic lack of knowledge. Students have misconceptions that aren't fixed through education. And that same study demonstrated that through simple and effective educational intervention, you can reduce those stigmas and increase knowledge about mental health. So some of the most popular educational interventions that are out there. The entire Australian public school system uses a program called Mind Matters. And the program is a school and nationwide focus of creating a safe atmosphere for students to learn about mental health. It's not just in the classroom, it's outside of the classroom. It's creating an atmosphere where students feel safe coming forward and saying, I'm feeling sad, I don't want to get up in the morning, I'm feeling anxious, I have trouble talking to people I normally didn't have trouble talking to. A 2008 study looked into important topics for Mind Matters, and it found that the main topics that should be taught to students are emotions and the regulation, suicide and its prevention and how to seek help, and depression. A 2014 study done in Germany showed that even simple interventions can be highly effective. The study involved passing out simple pamphlets, booklets with information about depression to students. The pre-test for these students about their general knowledge of depression, students averaged a score of 50%. After introducing the material, the students' scores rose to about 90%. And even coming back and doing a post-test a month later, students' scores remained in the 70 to 80%, showing a statistically significant improvement in their education. And the focus of all of these programs, and any program that should be developed, should be making a safe environment to discuss important topics and available resources. So currently, the health education system in Pennsylvania, the academic standards from the Pennsylvania Department of Education put forward what schools should teach its students. And the document states, school entities will use these standards to develop local school curriculum and assessments that will meet the needs of the students. However, the topics mentioned only include eating disorders and drug use, and don't mention some of the most common mental illnesses that students will be facing, including depression, anxiety, suicidal thoughts and behaviors, and the associated risk factors. The main point of all this is that we are not meeting our students' needs through the educational system. So future research. This is part of my main lit review for my honors thesis. So in the coming semesters, I'm hoping to gather the perceptions and experiences of former students from Pennsylvania high schools, and also determining what their levels of mental health literacy are. And I would like to use this data to promote more mental health education to the state of Pennsylvania, demonstrate that there is a need for our students and a want from the students to learn this material. Thank you.